Good evening and welcome to Coronavirus What You Need to Know. This is the sixth program in our live town hall series. These programs are produced in association with the Sonoma County Department of Emergency Management and also with input from various public health agencies around the Bay Area and also many nonprofit organizations. Hi, I'm Darren Lachelle, President and CEO of NorCal Public Media.
And I'm Maddie White, Assistant News Director of Northern California Public Media. Coming up, we'll talk about food insecurity during this time, including how to shop for groceries safely, and what one local food bank is doing for those who are food insecure. We'll also talk with County Public Health Officer, Dr. Sundari Mays, who will be answering your questions. Darren Lachelle has the details on how you could submit your question to the newsroom. Darren?
It's easy to contact us and get your questions in for the program tonight and future programs. Send us an email at viewer@norcalpublicmedia.org. You can also find us on social media on Facebook and Twitter and Instagram, all under NorCal Public Media. Make sure to get your questions in about what's on your mind, questions and comments about the coronavirus situation in our area. Now, for those viewers who need Spanish language audio, the program tonight is being translated live by La Mejor Spanish Language Radio 104.1. So right now you can tune to 104.1 and listen to Spanish language audio for tonight's program. Now, coming up, NorCal News Director Steve Mencher is going to have a conversation with Susan Gorin, and she's going to answer some questions that viewers have had about the situation in the county right now.
Susan Gorin, welcome to our virtual town hall. Glad you could join us this week.
I am delighted to be here. It's great to be here. Thank you, Steve, and KRCB family.
All right, now let me start right away by asking a question that's come in from one of our viewers, because I think this will get to the heart of some of the concerns that I know the supervisors have been expressing. So here's the question. I know that there are steps in place to notify authorities if businesses are not complying with COVID-19 rules. But what if you have a roommate that's not working and is going in and out of the house multiple times a day or having lots of friends over? What should you do in that case?
Boy, that's a toughie. You would hope that by convincing your roommate that what he or she is doing is putting your life at danger, that should be enough. And maybe asking them politely to refrain from having friends into the house. If he wants to meet with his friends, perhaps he could meet in the backyard or on the street or just sitting on the front curb, of course, socially distanced from each other. As we've seen from the statistics of the COVID patients, sadly, many of them disproportionately, I think, fall within the age range of 18 to 49. That is the age that I'm very concerned about because people feel invulnerable to COVID. They say, oh, whatever, I'll be fine. And yet we know, and we've seen reports and had great examples of people in the prime of their lives die of COVID-affected disorders.
Now, in terms of the shelter-in-place order and the extent of it, are you starting to think that the shelter-in-place might be extended past the current date, which would be May 3rd, I believe?
Well, first of all, thank you to the community. So many of you are keeping in mind how important sheltering in place is, and we are being very effective in flattening the curve. The kudos to everyone in Sonoma County and to our public health officer for correctly predicting that this is the restrictive measures that we need in order to keep Sonoma County safe. So we are seeing the number of cases are not spiking, are not going through the roof, are not escalating, are not overwhelming our healthcare facilities. And that is just very relieving for all of us to know. But keep sheltered in place for right now, and let's keep flattening the curve. The specific answer to your question is we are moving forward in refining the modeling with some more demographic information, and certainly the number of cases that we are seeing reported in Sonoma County that may give us a better indicator about how we're moving forward through the curve. I think for sure we are going to be sheltering in place past May 3rd, and we'll be moving forward with an extension of that order. But how much past May 3rd is still a question mark. Our public health officer, Dr. Mace, is still predicting the apex of the curve to occur between May 28th and June 2nd. We may modify that depending on what we see happen in Sonoma County. But remember, we're still increasing the number of tests that we are performing in Sonoma County. So we still may see a pretty significant escalation in COVID patients. And I know also people are bristling just a little bit. They want access to the parks. They want us to open the parks. We're not ready to do that yet. Please be patient a little bit longer. But the supervisors in the county are in conversations with community leaders about what next. If you have some help, you can't be out there volunteering perhaps, but what you can do is contribute. And there are many community-based organizations that are waiting and desperately need your contributions. The Community Foundation of Sonoma County, for sure, any of the nonprofits that you have, UndocuFund or the Redwood Empire Food Bank. We have a whole list of organizations in Sonoma Valley and North Valley and West County awaiting your donor dollars. They would really appreciate your help. A few dollars or a few more dollars would be gratefully appreciated for rental assistance and for information to all of the folks in our county on how they can access some of the financial resources that will help themselves and their families move into recovery.
Thank you to everyone who submitted a question for Supervisor Susan Gorin. Next up, News Director Steve Mencher hosts a panel on food insecurity in our county. He spoke with Eric Muse, General Manager of Oliver's Markets. He also spoke with David Goodman, CEO of the Redwood Empire Food Bank, and Juan Torres, a Community Connections Manager with Catholic Charities of Santa Rosa. Steve starts the discussion by asking David Goodman about resources for replacing the free and reduced price lunches that so many families in our county rely on.
The Department of Education has allowed schools to enact their summer feeding program now, when normally school would be in session. And so children are now able to come in a drive-through distribution setup where they can actually come in a vehicle, not stop and eat, which is normally what is required, and pick up their meals and go. And in fact, even better than what I just described is that children don't even need to be present. Which is really lovely. So if children are sleeping or they have, some sort of daycare, that they're not required to be present.
Right. I read initially that food would not be distributed unless children were actually in the cars, and that's no longer true.
That is no longer true. That was the original way in which it was launched, but then they corrected that.
Okay. And for both Juan and David, is it easy enough for a family, wherever they live in the county and even in the Bay Area, but especially in Sonoma County, to find these resources and to connect with them? Perhaps I'll ask you, Juan, first.
Yes, we work very closely with Redwood Empire Food Bank, and they have an excellent website where they track all existing food distribution. So we often refer individuals to that website and their Food Connections desk. 211 does an excellent job of connecting individuals as well. And our front desk, Griselda, who is bilingual and can connect individuals very easily to our distributions and direct them as needed. We also have resource connectors on call to screen individuals for CalFresh. CalFresh is a huge benefit right now for our community, similar to unemployment. When people are in need, they can apply for that service. get some supplemental income for their families, and support the local economy and their local stores.
That's great. So we're going to be putting some of those resources up on the screen as we talk, and I think that'll be very helpful. Eric, we're starting to see in some of the food establishments, these sort of plexiglass barriers that separate the customers from the cashiers and the checkers. What do you think about that as a solution for these days when people are afraid of getting too close to someone who might be checking, say, their food in the aisle?
So what's reality and what's perception aren't always the same. But I will say with the plexiglass, we did install plexiglass a week or two ago, and many stores have. And it certainly gives the employee a sense that there's some division between them and the customer. And even if it helps a little bit, that's a move in the right direction. So I absolutely support the plexiglass. I think it's made life for my cashiers a little bit easier, because it's not so much the employees that don't understand the social distancing. It's so many different customers, so many different attitudes to what's going on. And not all of us think the same way. And so some people are more aware of social distancing, and some people need a few reminders.
Okay, thanks so much, Eric. Now, Juan, there's a question I know I read in the New York Times the other day that some places that were offering food were essentially overrun, that there were lines for what I read were sometimes miles of cars waiting to come into places where folks could get food, where they could get groceries to stock up. What are you hearing from your community about whether or not they can get what they need in terms of food when they go out to seek it?
So, Steve, at Catholic Charities, we work not only here in Sonoma County, but our surrounding counties as well. And overwhelmingly, the need is increasing day to day. As more information comes out, more restrictions, people are losing their jobs. The need is increasing. At our agency, we focus on increasing capacity at our existing distributions, and have even added one at our main office on Airway Drive. And there's multiple locations where we're looking at expanding and adding the frequency of distributions. Luckily, we have an awesome team that has what they do. We try to prepare the bags of food as early as possible. As soon as the truck drops off the food, we have a whole team assembles everything, and the interaction with the participant is minimal. So the lines have actually been very manageable. We've had our plan B to ask for support for local law enforcement to direct traffic, but at this moment we've been able to prepare those bags quickly enough and get participants out. So we haven't had that issue just yet. As we move forward, that might change. So we are adjusting as needed.
Okay, and Juan, I have a particular curiosity and concern for some of the undocumented members of our community, where these are the people who won't be getting that money from the government, the $1,200 that so many others are getting, that may not have the money in the bank, that may be the first to lose their jobs in agriculture or in landscaping or in many of the food industries and others. Are you particularly hearing from the undocumented community that they're able to source the food that they need for their families?
This population is a huge concern for our agency. Out in the community, we're known for two main service areas. One is our housing and shelter, and the other is for our immigration services. While we're not a food bank, like the Redwood Empire Food Bank, throughout the country, about half of the participants that come to our agency for help is for food. So that need is very apparent. It's there. And with all these different resources that are out in the community, most of them are not open to this population. In the past, from our fires that we've experienced in the past, it's been very regional, and there's been funding that has been coming to our area, and we could address some of those needs. Today, it's a very different world. It's affecting the entire state, the entire country, the entire world. So funding is very limited. Our agency does provide client assistance, but at this moment, it's very challenging because it's very limited.
David, let me ask you, I imagine somehow that you are a numbers guy. Are there any numbers that you can share with us of the amounts of foods and the things that you're doing now that are ramping up, that are very different from what your year ago might have done, or even 6 months ago?
Here at the Redwood Empire Food Bank, we do emergency food boxes. We're one location of many throughout the county where people can collect emergency food boxes. Prior to COVID-19, in a given month, we would distribute 125 boxes during a month. And now, just last Friday, we did 275 boxes in one day. Pretty big change. On any given month, these boxes I'm talking about, in total, we would pack approximately 1,250 boxes. We're now packing 7,250 boxes in a day. Now, those aren't all being distributed. We're building as fast as we can because we know that this is a tsunami that is yet to hit. That we're at the stage of the game right now where the ocean has receded. We're all staring at a bunch of sand going, wow, that's amazing. I've never seen anything like that before. And there's a wall of water coming towards us that is something that we've never experienced other than the Great Depression.
That's very sobering, and thank you for that. Eric, we also have gotten many questions into us about how people should be handling the food once they get home. Can they be assured that their food is safe, that what they're bringing into their homes can be eaten without any danger of virus? How do you think about that as the general manager of Oliver's?
I try to be very realistic about it. The idea that I could guarantee that there's never going to be any risk on the food that they receive from any grocery store, frankly, at any time ever, is just not realistic. General health and safety practices are wise. Wash your produce, cook your produce. Make sure that when you get home, when you have a bag of groceries, as you're unloading it, hopefully with some gloves on, just wipe it down, spray it with some light, the cans, the boxes, those are easily sprayed down with Lysol before it ever touches your counter. And I think if you practice those measures, you would be reasonably safe.
So I know you guys are very busy. I'll let you get back to work. And
Actually,
thank you.
Eric, before you hang up, I could have taken all of your answers and rolled them up into my answer. So it's really interesting, though, that it's compelling the sort of the front line, the essential workers, and we are just like you, where
Right.
we are feeling like, hey, man, we're out in the front line. We're meeting thousands and thousands of people, and it is just, you're just naked out there, and that how to get people to feel comfortable, and that whatever that speech looks like where you say, who are you? It's up to you, because they don't have to be here. Unlike firefighters and police, they're not paid. They don't have to show up. Economically they might have to show up, but
Right.
They're not obligated by some contract. And so now you just end up appealing to, once you get beyond the economic part of it, just when you punch through this thing and you look back, who do you want to be? Who do you want to say you were? Were you fight or flight? And it's...
Yeah, they're certainly looking in the mirror. The economic reality of it, as you're talking about, David, is that most of the people that we employ here in the stores, they're living paycheck to paycheck at best.
Of course.
And as soon as they get a little too scared and have to leave, if they don't have the resources to put food on the table and pay the rent and take care of their kids, so they're really stuck between this rock and a hard place with, I'm terrified what could happen to me, but do I have a choice? And that's, we got our entire buying team trying to source these things like masks and plexiglass and gloves and all that. So anything we can do to support you guys, please let us know.
I echo everything, Juan, everything you said. I mean, it's just like it's all one big answer.
Yeah, we're all in the same boat. The challenges that we're all seeing, they're not unique. We're all seeing it. And the other thing is, when you build a team, everyone feels comfortable being around each other. That's another big challenge.
Yeah, that's true.
Your questions are very important to us during these town hall programs. We want to hear your questions right now. You can post those on our live stream on social media, Facebook, Twitter, Instagram, at NorCal Public Media. You can also email us right now at viewer@norcalpublicmedia.org. You notice during the conversations we're having tonight, the entire conversations are based around questions that you in the community have about the coronavirus. So we take those all week long off of all of our social media feeds and our email, and we get those into each program every Tuesday night. So we need to hear from you. So get in those questions. Also remember, we have live Spanish language translation right now available to the community if you listen to La Mejor Radio 104.1. And now we're going to go over to Assistant News Director Adia White.
Thanks, Darren. We're joined now by Sonoma County Health Officer Dr. Sundri Mace, who will be answering some of your questions. Thank you so much for joining us again.
Yes, thank you for having me. I think I'll give the situational update first.
Okay.
So just to let people know what's happening, worldwide we have a little over 1.9 million cases with about 120,000 deaths. Here in the U.S., we have about 582,000 cases with 23,600 deaths. Here in California, we have 24,000 cases with about 725 deaths. So drilling down to our county, we're still about number 7 in terms of the Bay Area counties in terms of numbers. And hot off the press, we today have added 8 cases for a total of 160 cases, of which 70 have recovered, 88 are active, and we have the 2 deaths in our county at this time. Just a few important factors about our cases. I want to note that because we've been testing our close contacts to cases, we actually have the most percentage of cases now in the contacts. In other words, someone who was contact to a person with COVID. So 45% are occurring in contacts. And the age group is still, as it was before, the most cases happening in the 18 to 64 year age group. And then lastly, as we expected, the most cases, 84, are happening in the Central County, where is our urban center.
So you mentioned that cases are now higher among contacts. So does that mean that community transmission is going down? Is that good news for the county?
Yeah, that's really good news. We're seeing less and less cases of community transmission. Again, to remind people, that's when you have a case and you don't know where it came from.
Right. So I want to get into our viewer questions pretty soon here. But before we do that, you did on Monday announce that you will be requiring residents to start wearing facial coverings. What do people need to know about that?
Yeah, so it's very similar to the guidance that we gave out the week before about facial coverings for people when they leave their homes for their essential business or essential activities. But now it's of an order to cover your face in specific circumstances where you'd be more at risk. For example, going into an indoor facility like a grocery store. If you're in any other enclosed space, or even if you're outside, but if you can't perform social distancing and feel that you're less than 6 feet away from other people. Now, these are not masks. We're calling them facial coverings because these can be made out of anything, really. Many people are making homemade masks out of fabric that's rewashable and reusable. You can also use a bandana, a scarf, a handkerchief, whatever will cover your nose and mouth safely. These things can be reworn and washed, I said, and I think it's very important for people to know not to wear the N95 respirators or surgical masks that we need so dearly for the healthcare providers that are taking care of patients.
Does that still apply? Because I know a lot of people have lived through many fires here in Sonoma County and have those on hand because of the fires that they're not able to donate. Are they still able to wear those masks, or are you recommending that they don't wear them at all?
You know, if you have one, it's expired, you've already used it, absolutely, I think you can use it. I'm just saying if you have new or unused products such as masks or any other protective equipment, please do donate it to Salvation Army and to the county.
Right, and again, you know, anyone should have these materials at home, so you're not requiring people to go out and buy anything new. They can use any t-shirt or bandana that they have on hand
Exactly.
already.
In fact, many people are using their old fabric or old t-shirts to make their masks out of, and there's many different videos on YouTube and other places where you can find out how to do this.
And in other major news today, Governor Gavin Newsom started giving some details about what criteria would need to be met before California can begin relaxing the shelter-in-place order. Does Sonoma County have similar criteria that you can share with us?
Our criteria are actually really similar. We may have some differences based on our own county situation, and we're looking at our modeling data, which we're getting more of, and working with our other counties. And our initiatives might look a little bit different. In other words, our goals before we release or relax on shelter in place, but they'll be very similar and aligned with the state.
Do you have some examples of where they might differ?
Well, we can look at our own cases. In other words, since we're having modeling that predicts when our surge would be, if the state surge is actually still predicted to happen a couple of weeks before ours, then we would definitely use our data as to when we could relax some shelter in place. The other issue is, for example, we have a parks closure. Certainly that's not a statewide initiative, so we might look at that specifically for our county.
So this is a perfect jumping off point to our first viewer question, which has to do exactly with Governor Newsom's announcement today. So considering that one of his criteria is increased testing, Sonoma County has not completed testing of much of the population. We have heard that the surge will not be until late May or early June here in the county. How can we feel comfortable if the state of California relaxes the stay-at-home order earlier than Sonoma County? Is this something that you're concerned about?
You know, our order would supersede the state order. So even if the state were to relax its order earlier and ours were still in place, ours would still need to be followed. So I don't think I'm as concerned about that. And as I said, we're tailoring our order specifically for our county.
So we wouldn't need to worry about other people from counties coming into Sonoma County, perhaps if they were a resident of a county that did not have a shelter-in-place order coming here?
Well, we would need to look at that and maybe tailor the language so that we do protect our community if that were to happen.
Right. So this next question has to do with testing capacity again. We all know that widespread testing is absolutely key to lifting the shelter-in-place, not to mention that early detection improves outcome. Testing might have saved Mary Lou Armour, who was reportedly denied a test twice. When will we have increased testing in Sonoma County?
Well, I think we're already doing a lot more testing than when we were about 3 weeks ago. And that's because we have, as I said, more labs that are doing testing. So we have all of our hospital labs on board doing their own testing. Our public health lab is maximizing the testing with close to 100 specimens being tested daily now, when it was more like 40 or 50 even a week or two ago. So we're increasing testing. We have been able to order a lot of the testing kits that we talked about before that are in shortage. So that's all really positive, and I'm sure you'll have a question on the new antibody testing, and I can go into that when we have that question.
Let's go for it now.
Okay.
What is the news on that?
So there is now a blood test, or a few different assays that are available. They don't actually test for the virus, as these swab tests are testing for, but rather for your antibodies to the virus, meaning we can detect if someone has had the coronavirus infection by testing to see if they have immunity. So once we have this test, it's a very short turnaround time. I hear that we can have a result in as little as 5 to 15 minutes. So that would really revolutionize our ability to test more people.
Do we have any idea of how soon we could possibly get those tests?
Well, we put in requests, and I'm sure that we're in queue to receive the tests. So we'll let you know as we have updates as to when we're able to start testing with that.
And I imagine, of course, that that would help with the shelter-in-place order on being able to relax that. Is that correct?
Well, the more testing we can do, definitely to detect active cases and people who've had COVID infection and maybe we're asymptomatic, and we can do that with the antibody test potentially, then we would be able to look at the shelter-in-place relaxation.
All right, so this next question has to do about when that will be lifted, which I'm not sure you will have an answer for us, but let's do our best to give people an idea. If the peak of COVID-19 will not be until mid-May or early June, does that mean the shelter-in-place will be in place for much longer or for the first part of June?
Well, we're looking at that, and the data should direct how we go forward with this. We've already said that we kind of want to see a plateauing of cases or even a decrease in our case numbers before we can really effectively look at completely loosening or removing shelter in place. That doesn't mean we may not make some small modifications to make it a little bit easier for people while we still have shelter in place.
So are you saying that people can more or less assume that during the surge we'll have to wait until the surge passes?
Well, if our cases are rising, I don't think it's a time for us to
Right.
remove the shelter in place.
That makes a lot of sense.
Yeah.
Okay, so this next person, it's a little bit of a personal story, so I'll try to do my best to paraphrase. So they say that they know someone on their street who was told by a physician that they likely had the coronavirus, but they did not have a test for them. Mm-hmm. So the question is that there must be many more folks like this who can't be tested. Is there some way to figure out how to count these people who are suspected to have the virus but won't be able to get a test? That way we get a closer to accurate count of all the cases in the county.
Yeah, there's a couple of recent things that we've done that might help with that. First of all, we do have something called a blanket isolation order. And that means that when a physician either makes a diagnosis of COVID-19 or suspects that someone has COVID-19, even if they don't have a test, they will need to be put under this isolation order and told to stay at home. Now, when that happens, the disease control section at Public Health gets a notification. And we'll find out whether they had a test performed or whether they're considered a clinical case without a test. So we will have a way of tracking that moving forward.
Wow, that's good news to hear that we'll start to get some of those numbers in as well. So speaking of that order, I think maybe we should unpack this a little bit. So this was something that you announced on Friday, right. And it applies to who will need to quarantine versus who will need to isolate. Can you talk a little bit about the difference between quarantine and isolation and who will be directed to do what?
Right, so when we have a person who's been diagnosed with COVID, whether it's because they had a positive test or because a physician thought that they had COVID, they're asked to isolate at their home for at least that 7-day period, if not longer, depending on their symptoms. That means they are restricted to their room with a bathroom, and they're not to go anywhere outside of that, and definitely not outside the house. Quarantine is for the contacts who may become symptomatic. These are people that we're aggressively testing now, and we're asking them simply to remain at home and monitor their symptoms. Check their temperature twice a day, and if they get any symptoms consistent with COVID, immediately call us with the understanding that we're also reaching out to them and monitoring their symptoms.
Right, so the difference is, one, you're required to isolate within your home, make sure that you're not passing it on to people who are with you, and the other one is more about making sure that you don't pass it on to the community.
Yes, exactly, but still staying at home for quarantine.
Right. Mm-hmm. Okay, so the next question, when the dashboard shows the total number of tests performed, are all of those tests still given in the county, or are they still tests where you only have, where you're given the results? So I think what this question is getting at is, are you only counting the public health lab tests plus positive cases, or are you now able to get all tests performed in the county?
Yeah, we're getting all the tests performed because that's a reporting requirement. In other words, even if the test is sent to Quest, mm-hmm. which is a commercial lab doing the tests in Southern California, they are required to report to us. So not only the positives, but the negatives are being reported from all labs. It's a requirement.
Wow. So if it's done at Kaiser or Sutter, doesn't matter the hospital.
Right.
Okay, that's good to know. So how is it that you can only get a COVID-19 test when you meet a very specific criteria, which by all accounts likely means that you're sick with the virus? But according to the county's website, only 4% of the tests are coming back negative. So we've had this question before, so I think people are a little confused. It seems like those percentage of positive tests should be higher, but we're still seeing that only 4% of tests are coming back positive.
Okay, that makes sense, right. Yeah, so it just means that a lot of people are being tested with symptoms, or maybe they're even asymptomatic. They could be the contacts that we're reaching out to, and they're turning out negative. That's about right, actually. We wouldn't expect 50% of people with these symptoms to be positive because the symptoms are really common with other things other than coronavirus.
Do you expect that to change as we move more into the summer now that flu season's over?
Yeah, actually, maybe now more of the people that have those specific symptoms may be COVID positive. We'll have to just monitor and see because the common cold is also really a common diagnosis, and that'll be COVID negative.
Right.
Right.
So how is this county deciding who has recovered in the community? So this again has to do with testing capacity. So the standard practice is not to count someone as recovered unless they have had 2 negative tests for the virus. But again, this person says that they've spoken with someone who is determined to be recovered but did not have 2 negative tests.
Yeah, so initially in the beginning of this situation, CDC was recommending that you get 2 negative tests to show that someone's recovered. Very early on, even like probably 3.5 weeks ago, we stopped doing that because it's clear that people can stay positive for a much longer period of time and they don't have viable virus. In other words, they're not infectious. So now we're saying that if you have been, it's been 7 days and you've been asymptomatic with no fever for 3 days, then you're considered recovered. So there's different criteria for recovery now.
I think some people are confused about that too because I've heard 14 days as well, which is the number of time that you have to isolate. Can you explain that a bit more?
Right, so the 14 days is what we're using for contacts for quarantine because they could become a case within that 14 days. So when you get an exposure to somebody, we're worried about you for 14 days, so we quarantine you for 14 days and check your temperature and symptoms. When you're a case, the CDC now recommends that once you're asymptomatic and you've been isolated for 7 days, you've recovered at that point and you're very much less likely to be infectious.
And the second part of this question I will mention was that this person was specifically concerned that, that wasn't necessarily viable. There wasn't enough evidence to say that they're no longer contagious. Is that correct? Are you concerned that they still might be contagious despite having it having been 7 days?
Yeah, well, there's never a guarantee 100% that someone is non-infectious at the time that CDC recommends that we consider them that. In fact, the CDC language states that there's very little data on this virus and we're making our recommendations based on the best data available. Right. So sure, someone might be infectious for a little after that. That's why we're also saying that with shelter in place, those people are staying home now as well, and they're not going out in the community.
So that will reduce a lot of the chance that there will be those errors in the community. So we're moving into some health and safety questions. Of course, as we get closer to summer, everyone's worried about fire season here. So this next question is, how would social distancing work if a fire with evacuations occurred in the county?
Yeah, then we'd have one emergency on top of another, and we would have to respond to the immediate emergency, which at that point would be a fire. And so I think that we may have to relax some of those guidelines as we're trying to save people's lives in an acute situation like that.
Right, so that of course would be more important immediately than maintaining social distancing, which would not be a great situation, but
it would not be a great situation, but we'd have to do the best that we can.
Okay. So what about in supermarkets? Are merchants responsible for enforcing the 6-foot distancing by employees or between customers? This person says that one outdoor market's cashiers were only 3 feet apart. So customers, of course, were only 3 feet apart. Would this be a violation on the merchant's part?
We are asking all businesses that are open to maintain social distancing and follow these regulations that we set out. And in fact, the new facial covering order does require employers of businesses that are open to make sure that their employees are wearing facial coverings, either by providing them facial coverings or ensuring they have access to them or letting them use their own facial coverings. So there's actually an order in place for that, but the social distancing is a guideline and recommendation for all businesses.
What happens if someone violates one of these orders?
Yeah, so that's when if we hear about it, and we're made aware, then we can send the law enforcement out to check that out and ensure that the proper procedures are in place.
Would that be a misdemeanor then?
At this point, I believe that the law enforcement is trying to nudge people into complying.
Okay. So this next question, if we leave our windows open on a nice day while sheltered in place, can the airborne droplets from the passerby's coughing or sneezing, or simply talking without wearing a face covering, be carried by a breeze in our home? So this is kind of a tack on to a larger question of, is this virus airborne?
Well, it is airborne, but we know that the closer you are to the person, and if they're coughing or sneezing and very close to you, that's where we're probably going to more see the transmission. That's why we have the 6-foot social distancing. So I think if someone's walking by on the street and they're far enough away from your window, that you're probably not at risk because it's a 6-foot distance. I can't say for sure that there isn't some, small amount of virus that could be transmitted if there's a gust of wind or something, but that's very unlikely and pretty rare.
So of all the things we should be worried about right now, perhaps that's not something we should fixate on, although
Exactly.
trying to maintain best practices is always a good idea.
Yes, that's what I would say.
Okay. So on Sonoma County's dashboard, one of the sections is cases from a close contact with an infected person.
Right.
What does close contact mean in that case?
Okay, so what we're talking about is when somebody is diagnosed as having COVID, we ask that person to tell us everybody who they've been in close contact with. In other words, people who live in the same household, intimate partners, anybody that they've spent many hours with during their infectious period. And we at Disease Control will further look into their workplace and see if some people in that space also meet the criteria. And we can determine who's their close contact. So that's what we mean by close contact.
Okay, so we only have time for a few more questions here, but I want to get to this one because for several of these answers, you've mentioned that, we really don't know that much about the virus. There's still a lot of research being done out there, and this question pertains to that. Are you concerned that all the recommendations to the public about social distancing, masks, the incubation period are based on very limited information, as there's still a lot that we don't know about the virus?
I would agree. It's a novel coronavirus. And the fact that it's new and has only been in our midst for a few months now suggests that we do have a lot to learn about it. And I would agree with that statement completely, that we are using the evidence we have to make the best policy guidance.
Okay. So this next question has to do with healthcare capacity. On your dashboard, it says that there's 21 people who've been hospitalized. I assume that means there's 21 Sonoma County beds taken up by coronavirus patients at the moment. Can you tell us more about what our hospital capacity is, how many beds we have available, and what the surge plan is?
Yeah, so the 21 is ever hospitalized. Many of those people are no longer hospitalized. So we can't conclude that all those beds are taken up at this point.
Okay.
We do have surge capacity. We're constantly polling our hospitals to see what their baseline numbers of beds are. And I think we put out some data that at baseline we do have some 700 or so, I don't know the exact number, beds in our hospitals. And the surge capacity allows for adding at least 50% more. So I think we're in a pretty good place with surge capacity. And I just want to let you know we have our alternate care site for which we've signed a contract with Sonoma State.
All right, well, thank you so much again for joining us. We look forward to having you in next week as well. Again, if you have a question for Dr. Sundari Mase, you can write to our newsroom, and Darren Lachelle can tell you more about how to submit a question for our show for Dr. Mase next week.
Great, thank you very much.
Thanks, Adia. Thanks, Dr. Mase. Yes, you can submit your questions to viewer@norcalpublicmedia.org via email. Also, you can find us on social media, Facebook, Twitter, and Instagram at NorCal Public Media. And also remember that tonight's program is being translated live in Spanish on our station that is helping us out, La Mejor 104.1 Spanish language radio here in Santa Rosa. So you can tune in for that as well. Now, next up, News Director Steve Mencher is going to be talking with Omar Medina from UndocuFund, and they're going to explore how there is aid and resources available and the challenges that our undocumented neighbors face.
Omar Medina, thanks for joining me to talk about UndocuFund.
Thanks for having me.
There's obviously a new emergency right now, and I'm wondering how UndocuFund is stepping forward, what the need is, and what you're doing right now.
So definitely the need now is actually, I feel, more than ever because everybody's impacted. A lot of people losing hours, their jobs completely paused. Uncertainty around rent for most people, that seems to be the biggest worry. A lot of the aid that's coming down federally, again, won't assist um, the undocumented community. And so they don't have a clear path for what's going to happen in the future. A lot of these ordinances around eviction, may help people stay in their homes for now, but without any clear sight of relief in the future, that we're not sure what's going to happen. Whether people will have 2-3 months of rent due and then be evicted.
There was a question that came in to us for one of the supervisors, but I think this is something that you could answer, and it's something that you hinted at. So the question was, consider a housekeeper or nanny who is unable to work due to COVID-19 and who may not be eligible for federal assistance funds, or consider someone who works at a restaurant whose hours have been scaled back. How can we possibly expect that they could eventually be able to work enough to pay back several months of missed rent once the catastrophe is over?
And that's exactly the big concern that we have. And so one of the big movements by a lot of social justice groups right now is simply forgiving rents or possibly putting a halt on rents, which of course there's implications to the landlords and such. So something has to be done, something has to be worked out. But if nothing is done right now, the way things are, those people, that nanny that isn't having any income, that's got rent due, you know, even if the rent is paused 2-3 months in, either they'll find some way to be in debt from loans or something that they might get from family and friends or even those payday loan lenders, or um, they'll end up being evicted. And that's my biggest fear right now, seeing 2-3 months out of this staying home order, that we might see people lose their homes because of it. And it's definitely not, it's not an intended consequence, but it's the reality of the situation that we're facing.
Let's say that my family has a head of household that's undocumented, and I am particularly concerned now. I have no income coming in. I'm worried about food. I'm worried about rent. I know that UndocuFund is out there and that you'd like to help. Can you tell me exactly how I should start and what I should do?
Well, there's two things. One, we put our waiting list online through our website, but we actually have closed that off because the right from the get-go, we received over 4,200 requests. So at that point, just seeing how big that need was, I decided to cut off the list, because I don't want to give people false hope that they might be getting aid when our income wasn't coming in. So as of right now, I've closed off the list, but generally it would be they would go to our website under the apply section, um, and get onto our wait list. And then from there, our volunteers would call to interview them, assess their need, and we'd go from there in terms of determining their aid.
Just let me make sure I have this right, Omar, because this is astounding to me that the need in our county is so great that you have, for the small amount that you currently have available, 4,000 people waiting to be processed, waiting to hear from you. And if there's another 30,000 plus undocumented members of our community and neighbors of ours, you can't even get them currently onto a waiting list for this help.
Well, we could get them on a waiting list, but it wouldn't do much help until we're able to get um, more resources. Right now, there is a lot of work to put pressure on the governor to establish a fund, and it sounds like he's talked about it, but nothing has been done yet. And until something is done, we don't wait on anything until it's done. So we're hopeful that maybe the governor and our state legislature will do something to maybe address this need, because these are essential workers to our community, to our economy, and we need something to be done. If not, we're facing bigger problems in the near future.
Certainly, renters across the state are struggling during this time. In San Jose, 2 council members floated a controversial rent suspension idea at last week's meeting that was quickly dismissed as unconstitutional by the city attorney. For many of San Jose's 400,000 or so renters, pandemic-related unemployment and housing instability is a concern. But some lawmakers worry that the burden on landlords would be too great. South Bay correspondent Pamela Lawrence spoke with 2 San Jose City Council members and a landlord, representing others like her who are looking for solutions.
The rent suspension item came up on Tuesday, and unfortunately, we knew that there was going to be a challenge with anything beyond units that are rent controlled to have any sort of control over the rents. Right. But we did think there could be an opportunity there, at least with the rent controlled units. But it turns out that we cannot get past our constitution, and so the city attorney in San Jose issued a response memo in regards to what we were asking. And what is legal, though, which is what has been done in a number of other cities. LA enacted this, and I know New York is looking into actually if they can sort of do what we were trying, a rent suspension. But right now, what everybody is doing is a rent freeze. And a rent freeze is just capping any increases. So San Jose has rent control, and we have a 5% maximum allowable increase. There's caveats where you can add a little more, obviously, if you're putting into some investments for certain reasons, but more or less around 5%. And we can knock that down to 0 if we enact a rent freeze as an emergency ordinance as well.
While lawmakers in San Jose are open to discussing alternatives to rent suspension, some council members, like Johnny Camus, don't want to burden the smaller landlords, the ones who will be directly impacted by any rent relief. We had the chance to talk about it this weekend.
It's tragic, but we also have to understand that a lot of these policies only apply to the smaller units, the fourplexes and the eightplexes or what have you. None of these rules actually apply for the big, Irvine properties, 1,000-unit things. The law in the state of California doesn't allow us to dictate rents for those owners.
And what are you hearing from those mom and pop landlords?
The mom and pops keep saying, you keep creating rules against us. You keep saying that you want big corporations to help, but you're not making rules on big corporations. You're only making rules on smaller mom and pop people because, quite frankly, that's the way the state law allows us to. And if you look back towards the testimony, that's exactly what our attorney said to us. You're only going to apply this towards the mom and pop housing providers, not the big corporate housing owners, right?
So what's the solution? What's the compromise so that those smaller mom and pop landlords aren't overburdened, but you're not seeing folks who become homeless because they can't pay their rent, or what other things can happen when somebody's rent burdened like that?
Well, the fastest thing to do is get people back to work. Most of these mom and pop housing providers are actually providing the lower cost property rents anyway. There are industries that can go back to work fairly safely. Your yard maintenance folks, I think, they don't touch anybody. They're usually with their mowers and blowers, not necessarily harming anyone, right? Or in physical contact with people. There's a lot of industries that we need to relook at and put people back to work sooner rather than later, so that we can get more people jobs rather than waiting in line for handouts at the unemployment office.
I also spoke with Jenny Zhao, the current president of the Bay Area Homeowners Network, a nonprofit trade organization for landlords. She advised members to voluntarily offer some rent relief to tenants. I wondered what she thought about the city's potential plans to mandate that.
First, we are all mom and pops. So rental, we may own 1 or 2 or very few smaller buildings or even single families. And most of us have a full-time job, or we are seniors, and some of us are retired person. So we are, not a company. We are real human, and we live in the community. We were first shocked And then we were very frustrated, just mentally, very stressful, and also financially, we don't know how to deal with it. So it creates a chaos, a reaction. I don't know, because the government supposed to protect us all.
And we'll be including an update from the South Bay in future shows as well. So thank you again to Pamela Lawrence for that report. Every Tuesday, KBBF Radio does their town hall in Spanish on their radio station, and we want to provide you a quick update of what they talked about during that town hall. That's on Tuesdays from 5 to 6, right before ours. So today, Adriana Arizon, the county health educator, talked about the new order requiring all residents to start wearing facial coverings. Again, we talked about that today, but she added that there's instructions on socoemergency.org or the county's YouTube video that will show you how to create a mask if you only have a t-shirt. Richard Diaz, who is the Deputy Emergency Services Coordinator, talked about the new surge site being set up at Sonoma State in case we need to increase our hospital healthcare capacity. And the National Guard is here to set up that site, and they will be here until the shelter in place is lifted. Before we end the show tonight, we're going to go back to Darren Lachelle, who's going to tell you how you can submit questions for our show next Tuesday. And we have some exciting announcement about new ways you can also submit questions from our website. So back to you, Darren.
Thanks, Adia. And thanks for the great interview tonight with Dr. Mace. I think everybody learned quite a bit about that. And you can see from these interviews, they're made up of questions from viewers and listeners. Your questions are used to create these town hall specials. So you know that you can send in your questions at viewer@norcalpublicmedia.org. But like Adia said, we're instituting a new way to submit messages, and you go to our website, norcalpublicmedia.org/coronavirus, and you'll see it right there on the homepage. And we actually have a question form. It's very easy to fill out. You can immediately fill it out and send it, and it comes directly to us. It's going to be, it will enable us to answer your questions faster and to share them with different departments in Sonoma County and get you the answers that you need. So we thank you very much for watching the program tonight, Coronavirus, What You Need to Know. Remember, we are bringing you these live town hall programs every Tuesday night at 7 o'clock. So please do join us next Tuesday at 7 o'clock for this program here on KRCB TV, KPJK TV, KRCB Radio, and also streaming live on Facebook, YouTube, and our website. I'm Darren Lachelle, President and CEO for NorCal Public Media. Thanks for joining us, and have a great night.
You're watching Northern California Public Media, made possible by viewers like you.